Hello. The title of this speech is Cerebral Palsy, and it is to inform you of how cerebral palsy can affect a loved one. Cerebral palsy is an ailment that can affect people differently according to the type that they may have. Let's take a look at a few types. Do you have a loved one with cerebral palsy, or do you know someone with CP? Cerebral palsy is caused by damage done to the motor control centers of the brain that is developing before, during the birth of a child, and after pregnancy until about age 3. I will discuss with you a few types of cerebral palsy, and I will also inform you of the causes of them and what treatment process is needed for the person with the disability. I have a personal connection with this topic because that loved one for me is my daughter. We're going to start with ataxic CP. It is a very rare type of cerebral palsy, and it has a ratio of about less than 10. 1 in 10 people with cerebral palsy who actually get this form. The word ataxic comes from the word ataxia, which refers to the loss of coordination of the muscle, but mainly the limbs. This type of cerebral palsy, isn't as disabling as some of the other forms of CP, but just like all of them, it does affect a person's life in a very critical way. According to the brainandspinalcord.com, ataxia CP affects individuals with the ailment differently, such as the way they walk or to having a difficulty trying to button a shirt. Precise movement can be a challenging task for them. Mixed cerebral palsy is just what it says. It is a combination of 2 or more types of CP, and about 10% of mixed cases has a combo of spastic and athetoid movement that sometimes patients also have ataxia as well. Mixed cerebral palsy happens when there is damage to the extrapyramidal and pyramidal parts of the brain. Spastic CP is very significant to me. This is the type of CP that my daughter is affected by. While all types of CP is caused by damage done to the cerebrum or brain sensors, spastic CP is the most common type of them all, which this kind affects more than 80% of cases. This type of CP affects both the nerves and muscles. Spastic CP has a type called diplegia, which is when the CP is affected in the lower extremities of the body, usually in the legs, hips, and pelvis. And causes the muscles to contract constantly. During this process, the body is very tense and tight. The muscle tension is disturbed due to complications in the brain to nerve, then to muscle connection. There is also a type called quadriplegia. This form can affect the whole body, and this form is the most disabling and critical form of CP. Quadriplegic CP is caused from severe brain damage. We have discussed the types of CP, which is ataxia, mixed, and spastic, whether diplegic or quadriplegic, and what causes these ailments. And we will now discuss the symptoms of the 3 types of cerebral palsy. The symptoms of ataxic CP, according to ataxic cerebral palsy help.com, is unsteady walk marked with uneven steps. They noted that some with ataxic CP can walk unaided, but may use a walking aid or wheelchair. Apnea is a symptom of ataxic CP as well, which is a breathing pattern that is abnormal, but it is very rare that those affected with CP actually get this. There is also symptoms that follow the patterns of a person with CP, and those include seizures, mental retardation, impaired speech, impaired sight, or impaired hearing. Symptoms of mixed CP include involuntary movement that often interfere with speaking, feeding, reaching, grasping, and other skills requiring coordination movements, according to the cerebral-palsy-source.com. Spastic CP for diplegia are very tight muscles. Involuntary movement, dislocation of hips can be a symptom. This can be a direct result of spasming of the muscles. And unsteady hand is another symptom. Uh, the individual can also experience weakened limbs, and it can also trigger a stroke. At this point, we will discuss some of the treatments that are available for the patients that are affected by CP. BrainandSpinalCord.com said that physical therapy is a gold standard of treatment for all types of CP. So whether it is spastic or mixed, physical therapy is a great treatment for patients. Occupational and speech therapy can be of assistance for the patient and can help assist the person into a better and more self-efficient lifestyle. While some others will continue to need assistance, it is still beneficial for them to get therapy. Mixed CP is treated by symptoms that present themselves, such as if spasticity is an issue, they may be treated with medication. Sometimes surgery may be discussed if the physician feels it is necessary and will bring the patient a better quality of life. Spastic diplegia and quadriplegic CP is treated with, as I stated earlier, physical therapy focusing on range of motion and stretching. Again, and medication a physician feels is necessary for presenting issues. We have discussed 3 types of CP, what their causes and symptoms are. We have also discussed the common treatments for them. Cerebral palsy is very serious to those whom are affected by it, and it takes a great deal of support, love, dedication, and patience to deal with it. We have learned that cerebral palsy is caused by damage done to the cerebrum in the brain, either before, during childbirth, or after birth, and can affect a child up to age 3. This subject, again, is very dear to me because this is a reality for my daughter. So I want to thank you for allowing me to share with you the importance of cerebral palsy. So now when you look at that loved one or that person that you know that has CP, you can now have a better understanding of what that person may be dealing with. Thank you.